I'm a trauma surgeon. After undergrad, I spent 13 years in medical education and training to become a double board certified trauma and critical care surgeon. I'm here today because I wish my younger self would have known what I know now about fertility and family planning. You may envision yourselves having a long-term relationship, maybe even getting married someday. In that relationship, you will have some serious conversations about, are you going to buy a house together? Are you going to move across the country to start a new career? In that relationship, you'll likely have the discussions about whether or not if you want to have children. Well, if you want to have children and you want to have a career in medicine, I want to give you some expectations from my own personal experience to prepare you for your future. Now, you may be sitting there thinking, well, I'm not going into medicine. How is this applicable to me? Well, I challenge you to just pay attention because I know some of the things that I learn about fertility and family planning will apply to you in any field of choice that you choose. Now, let's talk about a career in medicine. The average age of starting medical school is 24. Medical school will take you about 4 years to complete, and then you'll go on to residency. Your residency training, although it's been glamorized by TV and drama, I'll tell you that residency is a very challenging part of your training. You'll spend almost 80 hours a week sometimes in the hospital and the clinic preparing to be a physician. Now, I'll tell you that you will sometimes have to do some training to subspecialize after in fellowship. Now, after you're done with all your training, you'll be anywhere from 31 to 35 years old. At this point in your life, you will be done. You'll take a job and you'll be a physician. You'll have a lot of clinical autonomy. You'll have a lot of free time on your hand and a little bit of extra cash in your pocket. This may seem like an ideal time for you to start family planning and having children. However, if you haven't done the necessary steps early in your career, you may find that you or your partner get diagnosed with infertility. And in an instant, you will be robbed of your money and your time. It's important to know the status of your fertility earlier in your training in order to prepare you for your future, especially if you delay your childbearing. Screening for fertility is very easy, as having a blood work and also having an ultrasound, which is not any more invasive than having an annual exam at your OBGYN. For a male, it's easy as submitting a sperm sample to the lab to test for your fertility. Now, if it's discovered that you have a problem with your fertility or you want to preserve your fertility for a future use, you can do what's called cryopreservation, egg freezing or sperm freezing. In the process of cryopreservation, a woman will prepare her body with medications, including injections, and then when her ovaries are ready, she'll go through a surgical procedure to have some of her eggs removed. These are then sent to the lab, and they are cryopreserved, egg freezing. This will cost you about $5,000 on average. For a man, you will submit your sperm sample to the lab just as you would do for testing, and this will be cryopreserved. This will cost you about $1,000. Now, I would tell you, if you want to go through this cryopreservation treatment, I would encourage you to do it much earlier in your career. Maybe when you're a pre-med student or you're in medical school, because at this point, your schedule is much more forgiving. Now, recent studies validate the fact that female physicians are delaying their childbearing years to much later in life. The average age of a female physician starting a family is 32. When we look at the general population, it's 27. We're also seeing that female physicians are relying more on the use of assisted technology for things like in vitro fertilization and IVF. We're also seeing that female physicians are having fewer and fewer biological children of their own. Now, while fertility declines in both women and men, fertility declines much more rapidly in females. In the general population, you'll see that there's 1 in 10 will have to suffer with infertility. What's even alarming is when you look at female physicians, and that rate is 1 in 4. Even more striking is when you look at it for female surgeons like myself, 1 in 3. Someone you know or yourself will be affected with infertility. Most women that I talk to about this tell me that they wish they would have done something earlier in their career to plan for the fertility journey that they're facing now. Including myself, I know 6 female physicians who are currently navigating the process of infertility as we speak. Now, let me just give you a rundown of how in vitro fertilization works, just the basics. So it's pretty similar to the cryopreservation process initially, where the woman will take medications to prepare her body and will then undergo egg retrieval and sent to the lab. At the same time, her partner will then submit a sperm sample to the lab, and the egg and the sperm are then joined together for a possible fertilization. Now, if the egg is fertilized, it will then go into the lab to mature. If it matures over the next few days, the egg can then be replaced back into the woman for a potential pregnancy. Now, I tell you a lot of ifs and potentials in this process because you have to know that not one round of IVF will equal one baby. Lots of couples have to go through multiple cycles of IVF just to have one baby. I'll tell you from our personal experience, we're currently going through our first round of IVF, and we've spent over $30,000 of money out of our pockets that's not covered by insurance. And I'll tell you this much, the cost was the easiest part for us to contribute when compared to the time that I had to take away from my clinical duties and ask my partners to cover for me at work, and not to mention the toll it took on my body emotionally, physically, and mentally. If we want to create a culture in medicine that is acceptable for women to be in all levels of academia and all positions of leadership, we really need to take into consideration cultural and changes in medicine to make it more attainable to have a family. Any one of you can make this change. I encourage you to talk about this on a daily basis if this is something important to you. Talk about it with your colleagues, your mentors, your faculty advisors. I would encourage you to join local or regional organizations. You can talk to people like me that are already advocating for change for it. Do not underestimate the power of your voice. A simple conversation can go a long way. You may be wondering if 18 years ago, yes, 18, when I graduated from undergrad, if I would have chosen a career in medicine, knowing what I know now and dealing what I'm dealing with our fertility journey today. And I would say yes, of course. But I would have done things a little bit different and advocated for the things that I didn't have. Now I have the opportunity to pave the way for you, to help transform this challenge into a change. I trained for 13 years to be a trauma surgeon, to be there for you on some days your worst day of your life. Medicine is very demanding of physicians, and this is made extremely evident over the last 2 years. We don't have to choose between being there for our patients and being there for our families. We can do both. If you want children in your future, I would encourage you, when you leave here tonight, please pursue a proactive approach in creating your own fertility journey. Thank you.